And welcome back, everybody, to Good Things Utah. It is time now for our Live Well segment with LDS Hospital. We do these every single Monday. And Joey Douglas is here. He's an RN at LDS. We're talking about depression today. It's a condition that affects 1 in 10 Americans at one point in your life. I think that number may even be higher, Joey.
You know, everybody knows somebody who's depressed. I can think of at least a dozen people that I know personally who do have that diagnosis.
What is it exactly? We all have our bad days. I mean, sometimes bad weeks. How do you know when it is depression and you should get help for it?
Well, depression's diagnosed by a doctor. However, some of the signs and symptoms can be that you're not functioning in your daily activities that you should be doing. You're not getting up when you should. You're not going to work like you should. You're probably irritable with family members when you really aren't meaning to. What
causes it? Do we know?
Well, there are some thoughts that genetics do play a part. There's also a thought that maybe that traumatic events have happened, and that can certainly contribute to that.
A life change.
Right.
What sorts of treatments are available?
Well, definitely if somebody's feeling like they're not functioning very well, they should be getting medical help, either through hospitalization or outpatient treatment. One of the times that you probably would need to be seen by an inpatient treatment center is if you're feeling suicidal.
All right, let's talk about the good news as it relates to depression, because there is some. This is treatable.
Definitely. The goal is to get to the point where you are able to function in life and be able to tackle the things that you need to be doing. So medication is one way that they treat it. The other way is counseling, and usually there's a combination of both. And the good news is I see a lot of people functioning in their day-to-day lives to where they are able to live a healthy life.
Well, and you're not alone. So many people are going through this and struggling with this. What advice do you have for family members? We've struggled with this in our family as well, and there are days that you just throw your hands up in the air. You feel like you're not saying or doing the right thing.
Well, a lot of times the best thing that you can do is just listen. Listening is usually what your family members need, because they don't feel like they're listened to. The other thing is following up with a treatment plan. So helping your family member go to the doctor, help remind them to take their medications regularly and not stop just because they're feeling better.
You and I talked about this in the break, that often you say, I feel fine, I shouldn't take this anymore.
Right, and that's a sign that possibly your medication and treatment's working, and you need to keep doing that.
Keep going, and visit your doctor regularly to see if there are any changes. I like this, it says, be healthy and help your loved ones do the same. I think that's great prevention for depression. Exactly.
So some things that you can do to help prevent depression is, you know, live your life healthy, go on walks, eat healthy, release your emotions appropriately to your family members, talk to them about your problems.
And then you listen. That's your job. Family members, right?
Exactly.
That definitely helps. If you have questions, LDS Hospital, a great place, a great resource for you. Do go to our website, goodforutah.com/GTU for more information. But also there's a phone number on your screen at LDS Hospital Behavioral Health Services, and we'll put that on our site so you can get that. And if a loved one needs it or you do, make sure you call. Joey, thank you so much
for
being here. We'll be right back.